The GI Genetics and Cancer Prevention Program is a medical home for people who are at high risk for gastrointestinal cancers based on their personal or family history.
About 15% of people who get tested who have colorectal cancer may have some underlying predisposition to actually develop colorectal cancer in their family.
We routinely get referrals from providers who maybe have taken a family history, or they're seeing them because of a new diagnosis and they think their personal or family history is suspicious. We also see patients that routinely seek us out, so it's both provider referral and also self-referrals who are concerned themselves about their either personal or family history and are seeking the advice from a genetic counselor to see if genetic testing is something they could benefit from.
So maybe they have a cancer diagnosis themselves or a family member who has a cancer diagnosis. And when we meet with them, we assess their risk by taking their family history, talk to them about the option of genetic testing, and if they decide to proceed, that's something that we follow up with them afterwards. Another big part of our role too is to be an advocate for patients and make sure that their voice is heard.
If people decide to undergo this testing, a lot of times I'll collect a saliva sample and they do the testing from that. If somebody had a positive result, that does not mean they will definitely 100% get cancer. That means that their overall risk of cancer would be higher. So for those patients with those results, we can screen those patients more carefully so we can prevent them from having that cancer, or you can catch it when it's very easy to treat.
I think the best part of my job is just working with patients and putting their minds at ease, knowing that they're in good hands.
Having a warm, welcoming team around them is the first thing that they can expect, with the goal of they're our center focus and we want to make sure that they're on the right track moving forward.
The test results that we get really are kind of better and best. Meaning there's not a bad test result. If somebody's diagnosed with a hereditary predisposition, it was there since birth, right? So it may not be the best result, but it's a good result because now I know and I can do something about it. So giving somebody that diagnosis is really giving them the power to do something about a risk. And then as a genetic counselor, seeing additional family members come in and empowering them with that information and being able to take control of a risk really is the most rewarding part.